make I go love you tender, tender, oh, tender, oh. My love the eternal, eternally, eternally, eternally. I love you for eternity. Oh, my love the eternal, eternally, eternally, eternally. I love you for eternity. Oh. I'll swim the deepest ocean to show my devotion, yeah. You know, see me open like a window, my love. I go walla walla for you. You know, see me feel you.
Okay, good afternoon, everybody. Thank you for those joining on time. Thank you for those who are here on Zoomland and over on YouTube. We are now ready to begin, so I'm going to hand over to our lovely host, Omalora Wilson.
Hi, everyone. Are you hearing me? Allow me to turn on my mic because I want to ensure that we have a fun-filled evening, and it's only appropriate that if we're going to have that type of evening, that you get to see my face. I know you guys are excited. I know everyone feels, motivated. You're driven about having these discussions, and so it's a privilege to have you guys here this evening rather. Still waiting for Zoom to turn on the mic, so bear with me. Okay, beautiful. So how are we feeling this? Is my camera on?
No, it's not on.
We're not
We
seeing
just,
Omalora.
we just did technical testing. I'm not sure what started the problem. I'm like, oh yes, I can see myself. So that means I'm on now. How are we doing, guys? How are we feeling this evening? If you're feeling motivated, if you're feeling passionate, if you're feeling driven, just comment in the chat so we know that you're there. All right, I can see you guys out there. All right, and I know we have persons over there on YouTube as well who is ready to join and participate in the conversation. My name is Omalora Wilson. I'm the Faculty of Social Sciences Guild representative here at the UWI Mona campus. And of course, it's a privilege for me to be participating in this initiative. It's a privilege to be having this conversation with all of you. And so, without further ado, we want to get right into it. We want to start having the conversations. We want to know what it is, how crucial it is as well to have this type of conversation. I want to say as well a big thank you to the UWI Mona Community Students Office to be having and facilitating this conversation. And so, intelligent people who are well aware of the topic, the conversation that we're going to be having this evening. It's a privilege to have you guys here. It's a privilege to know that you want to be participating in this conversation. And so we welcome you. But of course, we're not just going to say welcome like that. We have to do it the way the community students do it. We're going to be having the actual official introduction of the panelists this evening. And so let's start off with the beautiful and amazing Dr. Samantha Johnson. And Dr. Samantha Johnson is a graduate from the University of the West Indies, and she is a medical doctor in both public and private sector. She has a long history with advocacy, working with non-governmental organizations such as the Jamaica Medical Students Association, JAMSA, and JFLAG, and has been a woman empowerment for change, which is We Change ambassador for several years. Her passion for health advocacy and public health caused the creation of the layman doctor at home, a lifestyle focused on bringing medicine home and acting as an advocate for both patients and healthcare workers, but by providing education and improving access. And through various forms of media, the layman doctor bridges a gap between patients and the healthcare system by addressing unique issues within Jamaica healthcare system, done in a personable, relatable, and inclusive manner. An emphasis is placed on the sexual and reproductive health rights and LBT women. For HCWs, which is healthcare workers, focus is made on the soft skills, career development, and lobbying for improved treatment of healthcare workers. And in her spare time, Dr. Johnson can be found on Twitter painting her nails and watching poetry videos on YouTube. Ladies and gentlemen, a big welcome to Dr. Samantha Johnson. And of course, we move from Dr. Samantha Johnson to Miss Samantha Watson. And Samantha Watson earned her BSc in psychology from the University of the West Indies, Mona. She has 4 years experience in the sexual and reproductive health field and approximately 3 years working for the National Family Planning Board. And Samantha is currently the counselor at the National Family Planning Board in the Health Promotion and Prevention Unit. And she loves hiking, road trips, rivers, and watching historical and crime documentaries, and is passionate about life and people. T.A.B.S, of course, which is T.A.B.S Project, Talk About Your Business Safely, is a social outreach initiative, which is a department of the Asher Company that provides free services such as HIV and STI testing and counseling, psychosocial support services and referrals, edutainment, interventions, and empowerment and self-development trainings. And the T.A.B.S project was created and launched in 2011 and was originally a text line where disenfranchised youth and members of vulnerable populations could text counselors to ask questions and help about the issues affecting them in their sexual and reproductive health. This was to support the work Asher was doing under social behavior change projects in partnership with the Ministry of Health and Wellness, funded by international donors such as U.S. Agency for International Development, which is USAID, and Global Fund, where it was found that young people weren't actively being given information on these subject matters in the school education system. And then, of course, last but not least, we have let me catch my breath because we have Rudolph Rudy Tomlinson, and this is the assistant project manager on the T.A.B.S project. And this man, this gentleman, has been working in the public health sector with the Asher Company for over 10 years, focusing on sexual and reproductive health, HIV and AIDS, gender violence prevention, conflict resolution, and parenting, working with marginalized population. And with his gifts and talent in the performing arts, he has found it essential to use it as a means of edutaining persons, specifically to address the current issues fueling the spread of HIV and AIDS and other STIs. He recognizes the importance of empowering persons he interacts with, and he sees the need to sensitize persons in various groups of social vulnerability to explore their mental, emotional life experiences and to overcome their own self-stigma and the negative labels society has placed on them. And he's now pursuing his bachelor's degree in social work at the University of the West Indies. You know, so Rudy Tomlinson and I are good friends. You know, we've had a conversation recently. But ladies and gentlemen, those who are joining us here this evening, these are the panelists who will be having the conversation with the commuting student office. And of course, let's get right into it. The first question, I want to start with Dr. Samantha Johnson, going to Miss Samantha Watson, going to Mr. Rudy Tomlinson. And so my question, the start of the evening rather, is, and this actually is for Mr. Tomlinson. We want to know in particular, what exactly is a T.A.B.S project and how can persons follow or be a part of the project?
All right, good afternoon, everyone. Hope everyone is doing well. Everybody is fine. Let me just turn on my camera right now. Are you all seeing me?
Yes, sir.
All right, good. So basically, she gave a really good introduction of what T.A.B.S is and the work that T.A.B.S have done. All right, so T.A.B.S is basically talk about your business safely. In essence, T.A.B.S was created out of an initiative we had when we went into the schools and various community. But when we went to these different communities, what will happen is persons may not want to have conversations or ask questions in such a large setting. So what usually happens is they reach out to us on our social media platform asking questions. And we came up with the idea that, look, you can talk about your business safely in a very private way, and you can ask your questions and we can answer them. So that's how T.A.B.S was created in that way. But this is really a forum or a platform to talk about various things related to HIV and other social issues, really. T.A.B.S is on Twitter, Instagram, and Facebook, so you can reach out to us at the T.A.B.S Project. You can also call us at 504-2119. That's 504-2119. And you can also call us, this is our Western office now, 445-5876, right? Any more questions?
Sure. We do have some more questions, Mr. Tomlinson, but of course, I want to hold on that one and move the question now to Dr. Johnson. And Dr. Johnson.
Why do people believe that contraceptive pills are harmful to a woman's body?
Hi, everyone. Just checking if you can see me. Hi, everybody. Thank you so much for having me today. I'm excited to be a part of this conversation. And sorry. All right, so why persons think that repeat the question for me, please.
Why do people believe that contraceptive pills are harmful to a woman's body?
Okay, so why persons believe that contraceptive pills are harmful to a woman's body? I would think that this might have to do a lot with misinformation and this lack of dispelling myths around there. Most of us may know persons who do take contraception, and this is gonna be dependent on the type. Are you talking about pills, intrauterine devices, or even the injection? And it is known that a lot of these devices, a lot of these contraceptives do have some side effects, right? Some persons may not experience any, some persons may have some, and again, it depends on the type of contraception that you're using. So I think to dispel that, we need more education, more advocacy surrounding contraception, and particularly about the benefits of using different contraceptive measures. And then, of course, an understanding of the side effects that may happen and how you can go about improving those side effects, avoiding those side effects, or treating those side effects.
Okay, thank you very much, Dr. Johnson. Miss Watson, what is the National Family Planning Board?
Thank you for that info. That question, sorry. So Samantha Watson here. The National Family Planning Board actually is the government, sorry, the agency, the national agency responsible for sexual and reproductive health information and services. So we do research, we develop campaigns, we provide contraceptive methods, we provide services that caters to sexual and reproductive health, and a lot more. So anything regarding sexual and reproductive health, you're talking about National Family Planning Board.
Okay, thank you. The next question is for T.A.B.S. In your field, what are the main factors limiting persons from getting tested?
All right, so there are a lot of factors that are associated with persons not wanting to get tested, right? So persons still don't feel that they are at a risk of contracting HIV or other STIs. That's the first thing, because of culture. Our culture don't really promote safe sex. I mean, when you listen to our music, it is all over our music about stabbing and robbing and all of these things, and we are well aware of it, right? And there's no safe practice at all in these songs, and we're a culture that is really, we're a society that is really influenced by our music. So that is one factor. Also, persons are just afraid to get tested. Where when you talk to people or interact with persons, persons say, well, their mother dead with it, in a sense. Them no one know them status, period. But I think all in all, I think the lack of information is why persons don't want to get tested. I mean, I've interacted with persons already, and persons said that they rather get cancer than HIV, really. They rather get Ebola than HIV. So I think the lack of information is what is lacking in our society as it relates to the persons not wanting to get tested. Persons are concerned that others might find out their status. So those are some of the concerns. Stigma and discrimination persons have. Persons don't want to be stigmatized. Persons are also concerned that, okay, am I going to be judged if coming to a healthcare provider to get tested? So those are some of the concerns that persons may be limiting themselves from getting tested.
Okay, thank you. The next question is for Dr. Johnson. Can you use contraceptive pills for other purposes?
Okay, thank you again for that question. And yes, contraceptive pills can be used for other purposes. Primarily, they are used to prevent pregnancies. But if you have acne, for example, contraceptive pills can sometimes be used. It can also be used if you have certain issues with your period. Maybe you have painful periods, you have endometriosis, or even polycystic ovarian syndrome. Contraceptive pills can be used to help to regularize the period, as well as lightening the period too.
Thanks, Dr. Johnson. And I'm going to jump in a little bit because I know that Dr. Johnson has been speaking a lot about contraceptives, that it's not necessarily dangerous to a woman's body, and that it can be used for factors outside of contraceptives. But I kind of want to channel some questions to Ms. Watson. And I want to ask, what contraceptive options are available for women, and what services does the National Family Planning Board offer?
All right, thank you so much for that question. All right, so there are a lot of contraceptive methods available overall, but the most common ones that we recommend are the pills, the injection, the implant, the copper T IUD. Those are the main ones. So the long-acting reversible contraceptive methods, which are the IUD and the implant. The implant lasts for 3 to 5 years, and the copper T can go 10 to 12 years. The injection is for 3 months, and the pills, it's a daily dose method that you take a 28-day pack for each month, one pill every day for 28 days, or you have 21-day packs. We here at the National Family Planning Board, we provide the pill and the injections. We also provide condoms for persons who might stop by and want, some boots to protect themselves. The pills, you get a 3-month supply for $50, and you get the injection for $200. So we have a nurse that comes in on specific days that provide the methods for person. And you don't need an appointment, you can just walk in. And also, the pills and the injections are available at your local clinic if you don't want to come into our office, and it's free at the clinic. Also, you can get the copper T and the implant. Well, they're given at hospitals that provide maternal care, but first you'll need a referral from the public health nurse at your local clinic. Any other questions?
This one is for Dr. Johnson again. Can IUDs tear a woman's uterus?
I don't know if Dr. Johnson heard that question or she's muted.
Okay, so I'm going to repeat it. So, can Can IUDs tear a woman's uterus?
Dr. Johnson, your mic is off, all right? So just turn on your mic.
No, I'm not hearing you now, but I'm seeing that you're trying. I don't know if you want to plug out the earphones and plug them back in. That's like my go-to thing.
How about now?
Great.
Yeah, the plug in and plug out worked. Okay, so regarding your question about can intrauterine devices tear the uterus? Well, let's talk about what an IUD is first. An IUD is an intrauterine device, and that can be either your cup of tea or it can be a brand such as Mirena. And it is very rare that they can actually tear the uterus, but it is one of the complications and a fairly serious complication as well. But it is very rare. And during the insertion of the intrauterine device, care is taken so that it is placed in the uterus. So basically what they do first is measure the distance between the hole, which is a cervical os. So the hole that they're gonna put it in, which is at the neck of the womb, and the top of the uterus. And then they will go, when they insert it, they'll make sure that they don't go above that so that you can avoid tear. Other than that, it's very rare and very unlikely. If it does happen, however, you may have issues such as heavy bleeding, pain, and in that situation, you'll want to seek urgent care. When I was doing some reading on this topic, actually, I saw that you can have what they call subclinical tears, which is when you may have a little tear, you don't really notice, and it's more or less self-limiting. And that means that it will basically take care of itself. And usually you won't notice that's happening. But for the more life-threatening or more debilitating ones, if you're having symptoms of really bad pain, lots of heavy bleeding, maybe a weird discharge, fever as well, the belly is very painful and tender, you'd want to seek urgent care at that time.
Thanks, Doc. And before Omalora comes back in, there's actually a question in the chat. Can a female or male feel the copper T during the intercourse? I don't know if Dr. Johnson or Miss Watson wants to take that one on.
I can take that one on. The hard and fast answer is no. Usually what will happen is that you might experience feeling the string. So the way that it is inserted, it literally looks like a T, like this, and then it has a tail of a string. The T section is in the uterus. And for example, for the male partner to feel it, on the penis, it is very, very unlikely, just because of the coating, how the mucus in the vagina coats the string. It makes it almost barely feelable. However, they might feel it if they use their fingers. And another thing is, in terms of women feeling it, it's if you get one inserted, the person inserting might actually recommend that you check the position of the string and check if you can feel the string. So you can feel it if you use your fingers and insert it inside the vagina. Other than that, it really doesn't pose an issue during sexual intercourse, and it's very unlikely that your the partner doing the penetration is gonna feel it. And if they do, what can happen is maybe you go back to the gynecologist or the person that inserted it, and they may actually just trim the string a little bit shorter to make it a little bit more comfortable during sex.
Thank you, Dr. Johnson. The other question is for T.A.B.S. And are there any laws to protect your medical status in the workplace?
Yes, there are. There are laws. There are legislation that is stipulated under the Occupational Safety and Health Act that was in 2017, which provides a balanced framework to secure safety and health for workers. So, right, if you have any issues, you can just remember these acts that are provided for persons that may be facing discrimination or any sort of injustice as relates to their health. Wait, there are laws.
Okay, thank you. That is very good to know. The next question is for Dr. Johnson again. So do these STI or STDs resolve on their own?
All right, that's a good question, especially because we have a few myths when it comes to sexually transmitted infections or sexually transmitted diseases. And it's also going to be very dependent on what type of infection that you do have. No, I just want to point out that for women in particular, it can sometimes take a while to be diagnosed with a sexually transmitted infection, just because we're a little bit less likely to actually have symptoms. And this is one reason why regular testing, maybe once a year or so, just do a broad testing, is good, and ensuring use of protective measures such as condoms, whereas males are more likely to have symptoms such as discharge, painful urination, and so on. So for women and for men, if there's anything weird, let me not use weird, but if there's anything coming from the vagina or the penis, in terms of a discharge that is green, yellow, foul smelling, bloody, anything like that, when you pass urine, it's very painful. And you're just having discomfort, weird lumps and bumps, things that you've never seen before in that area, you want to go and check it out. Now, some sexually transmitted infections are not yet curable, one of them being HIV, herpes, for example, and something like genital warts, right? With genital warts, there's no a vaccine, which is great to get for both men and women. There is treatment available, and at some point, your body may in fact just clear that virus. Now, in other ones, such as gonorrhea, chlamydia, and so on, taking medication is very important, such as antibiotics, and that's really the only way that you're going to be able to clear that infection. So I would say no, you can't just really get over it. You will need some assistance for the ones that are curable, and hopefully for the ones caused by viruses such as HIV and herpes and so on, we will eventually reach the point where we do have a cure for those illnesses.
Thank you, Dr. Johnson. And I want to go back to T.A.B.S and Mr. Hamilton and some of the great work that he's doing. I know oftentimes we hear about HIV stigma. Do you see stigma associated with other STDs, for example, herpes and gonorrhea? And if yes, what do you use to tell persons to motivate them to get tested?
This is for me?
Yes, Mr. Hamilton.
Oh, all right. So really and truly for some, well, going back to culture again, in some communities, it is okay to get gonorrhea. It's almost like it is encouraged that, yo, you're not get the bite it, you're not get the sting it. It's almost like if you not get a burn, you're not saying nothing in a certain communities, right? So again, information is important. That is where persons need to be educated, because one, if if you have an STI, it needs to be treated. It's a thing where so we go out into various communities to educate persons, to encourage persons that testing is important, because I think Jamaica really lacks information as it relates to the different STI that are out there. So I think what we have done, what T.A.B.S has done, is to go out in communities to educate persons about the different STIs, because persons are still not even aware of the seriousness of gonorrhea, herpes, all of these things. People still take it as a joke, so yeah, but we are doing the work. We are going into communities. We're still doing the work. ASHA has been established from 1993, and from then till now, we're doing the work.
Yes, and this is very important work because sometimes persons feel a little bit more comfortable with you coming into the community as opposed to going to like a doctor's office or a more familiar space. But I want to ask Ms. Watson at National Family Planning Board, when should persons get tested for STIs or STDs? When is the right time to get tested? Do you do it every year or only when you feel something? What would you recommend?
Thank you for that information, for that question. I don't know why I keep saying information. But yes, well, just to highlight that we do provide HIV and syphilis testing here at the National Family Planning Board, and it is for free. And we normally recommend that persons get tested every 3 months once they're having unprotected sex. Why? Because HIV, after becoming infected, has a 3-month window period as to where it can be detected in the blood by one of the tests. So if you're having unprotected sex, say you have unprotected sex with a partner tonight, new partner, long-term partner, it doesn't matter. You have unprotected sex, you have concerns for HIV, you get tested in the next 3 months just to know what's up, what your status. So get tested every 3 months once you're having unprotected sex.
I'm loving the answers to these conversations because it's really giving us as young people some sort of insight on what's really happening in this world. You know, when you feel like you know it all, but then you bash and say, really, actually, I didn't know these things were happening. That is what is happening at this moment. It's education for us. It's education that we can bring forth to others when we leave this particular space. You understand me? And so, Ms. Watson, actually, I have a question for you. You know, we're talking in terms of your expertise about all the contraceptives and, you know, what National Family Planning Board does and the options that are available for both men and women. But then comes the question that I wasn't feeling well earlier, and the conversation kept going on and I'm like, whoa, I have to participate. But here's the question that I have. The understanding is that these things can be expensive. And so what we want to know is, what are the costs that are associated with different contraceptives options?
All right, thank you for that question. All right, so again, I'm going to highlight the most recommended methods. Those are the pills, the injection, the implant, and the copper T IUD. So for the pills, well, as I said earlier, you can get them here at our office for $50 a box, and you get 3 months worth. You can also get them at your local pharmacy overall. Again, with choosing a method, I don't recommend that person just go in and buy a method, especially if you're first time using it. It's best that you go in and speak to your doctor or family planning specialist or midwife before choosing a method. And if it comes to the conclusion that the pill is for you, then you can get it here for $50 a box, or you can go to your pharmacy. I'm not sure of the cost of it at the pharmacy, but I know it might range probably from about $200 to $500, probably based on, you know, when it comes to brands, brands are going to vary in cost. So it depends. You can check that out at your pharmacy if you're already on the pill. For the injection, here we offer it for $200. However, if you go to your local health center, you can get it for free, actually. If you want to go to a private facility like your regular doctor, I'm not sure of the cost that it will, you will get it there. I've heard ranging costs between $2,500 to $4,000. For the implant, well, I'm going to group them. The implant and the IUD, IUCD actually, you can get those for free in the public setting, but you'll need a referral from your public health nurse at your local clinic or health center, as we call them. Yeah, you can get a referral, take it to the hospital that provide maternal care in your parish. For Kingston, that would be Victoria Jubilee. For Spanish Town, that would be Spanish Town Hospital. And for other parishes have other public hospitals or hospitals that provide maternal care. And it will be free in those settings. However, going to the private space, the cheapest I know it for within Kingston setting for, let me just double check my info. Alright, so the IUD I've heard for $4,500 and the implant for $7,500. and that's for a location in Kingston, Jamaica Family Planning Association, if I'm not wrong. Yeah, they're located at 65 East Street. However, in other public setting, it might range a pretty penny. So persons can weigh their options. I know that some persons might prefer dealing with a private facility over a public setting, but it really depends on where you prefer. And then again, want you to know that there are options there where you can access free of cost, so that you have options to choose from, and not just thinking that everything is gonna be a pretty penny. All right.
Thank you, Miss Watson. Before Omalora comes back in, there was a comment in the YouTube chat that actually says students can access OCP and Depo-Provera at the UWI Health Center, Mona. Even though it's not free, it's at a subsidized cost. So that's another avenue for persons. We also have Dr. Johnson in the chat answering a couple questions. Somebody asked if the implant, if the insertion, is painful, and Dr. Johnson is saying level of pain is dependent on each person. There is some pain which doesn't last long, and afterwards some persons have cramping similar to periods. It varies from person to person, so you can have a conversation with your gynae or nurse. And then she also said that the implant is inserted just underneath the skin. It's no longer the term contraceptive choice. It has hormones like the pill, but you don't have to take it every day. So back over to you, Omalora.
Thank you so much. And there's something as well that I wanted to pinpoint, Ms. Watson, when you were talking about the availability and the cost for things like the pill and stuff like that, And I want to say this to all the girls in here. I'm no expert, and I want to say this to all the young people in here, but I feel as if it is relatively affordable when you talk about, the pills and certain contraceptives. Some of them are actually free. Most of them are actually free. And that's the beauty of it, because I remember when we were doing a project about sexual health, and we went to the pharmacy, and I was surprised. And I was really, but Dr. Miss Watson, I still want to ask you a question, seeing that we're on the conversation of contraceptives. I actually went into it a little, but I want you to expound fully so that everyone here understands. The cost is we know the different contraceptives, we know the cost for them. Now we want to know as young people, where can we get these contraceptives?
All right, no problem. So with a pill and injection, they are free at your local clinic, or if you don't want to go to the clinic and you want to come here at the National Family Planning Board, we offer the pills for $50 and the injection for $200. For the implant that goes into the upper arm and the IUCD copper T that goes into the uterus, that is done at maternal hospitals, such as Victoria Jubilee and other parishes of other hospitals as well that provide the method free of cost. But before getting it, you will need a referral from your public health nurse at your local clinic. So your regular health center, clinic, you go in, you talk to the midwife, midwife speak to the public health nurse to get you the referral if that's your preferred choice, based on the counseling and conversation that you'd have with the midwife, and it says that, all right, your preferred choice would be the implant or the copper T. You get the referral and take it to the hospital to either set an appointment or get it done same day based on availability. All right.
Thank you so much, Ms. Watson. I like that. And I feel as if, with these obviously questions being answered, just read more questions. Because here it is really happening in the chat, just so I can call it properly. It is Annalie. Annalie Williams wants to know, and I think I'm going to put this question to Dr. Johnson. And then the question that Rajay has, I want to put it to Ms. Watson. No, Dr. Johnson. Annalie wants to know what are the side effects of hormonal contraceptives. And then after you answer the question, Ms. Watson, Rajay wants to know about where can the men get their type of contraceptives.
Okay, so what are some side effects of hormonal contraceptives? Well, the most common ones can be period irregularities. So whether your period cycle changes, you might have lighter periods. Some, depending on what you have, some persons may actually have no periods. Another one is that you can get headaches from it as well. You can have acne as well, even though I said earlier that some can be used to treat acne. You can also get acne from it as well. You may have soreness with your breasts. You might even feel nauseous. So those are some of the side effects that you can get. But again, it's going to be very dependent on the contraceptive that you use, and even from pill to pill there are even differences, and then there are going to be differences between the pill and the implant or even the injection. So they may have similar side effects, but based on what method you use, it's going to be different. But those are the most common ones for sure.
Thank you, Dr.
Thank
John.
you, Dr. Johnson. Go ahead, Miss Watson. This one is for you, and I'll repeat the question just to make it better. Rajay Bennett. Oh, and Annalise says, thank you, Dr. Johnson. So I think your answer actually really helped her a lot. But Rajay wants to know, Miss Watson, where can us dudes actually get contraceptives in Jamaica as well as just overall?
All right, Rajay, thank you so much for that question. And I think it's very important that we highlight this particular method. It's nothing new or anything that, is out of the normal. And what we normally recommend, because there's not much contraceptive options for the men to use other than one, the big bad condom or vasectomy, but that's for a later conversation. Well, condom use, I know condom use based on previous researches that we've done is not something that is consistently used in relationships. A lot of persons try to use natural technique like the withdrawal, but that can run into situations of pregnancy, unwanted pregnancy, and risk of contracting an STI. However, there are two types of condoms available, and I'm not going to focus too much on the female condoms, even though it's an alternative to persons who have latex allergy from male condoms. But for males, the real method that is promoted for you is the use of condoms. A lot of persons might not want to use a condom because they say, oh, it take away from the pleasure, or it's too tight, or a lot of excuses. However, condoms comes in so many different types. You can't believe the amount of types are out there that you can, try as many to see which one meets your needs, that you can enjoy sex safely. Because you have, wet and wild, you have thin, ultra thin, you have latex and non-latex condoms for those who are latex allergic. You have studded, you have ribbed, you have scented, you have flavored, you have so many that you can choose from. But guess what? A lot of persons will just try a one or two brand, and because they've never liked the feel of it, them just done with condom and say that all condoms are the same. And that's not true. If you're really interested in taking care of your sexual health, you'll find the ones that really suit your needs so that you can have sex and have it safely.
Thank you, Miss Watson. And before Omalora continues talking to the panelists, we actually have some comments over at YouTube. So Dr. Tina Hilton Kong says, OCP at the UWI Health Clinic Pharmacy, according to the brand, is about 250 JMD. Depo-Vero, the injection, will be administered and it's 1200 JMD, but health insurance can be used. She also says that students can be referred to the Hugh Winter Fertility Management Unit for the insertion of the IUD and contraceptive implants. So if you're living on Hall and it's cheaper for you to go to the health clinic, the health center is right. It's cheaper for you to go to the health center is right there. If you're not on Hall and you're a commuter and you're off on campus, and you're living in Kingston or St. Andrew, you can always check out National Family Planning Board, or like Ms. Watson said, your nearest service provider. Laura?
I'm actually in the chat reading the questions because each time one of our presenters gives some sort of communication, students end up asking something else. And I love that. I love that we're fueling the conversation. And so Ladekia, it's Ladekia, I do hope. Or is it Lacadia actually has a question for Miss Watson. And the question is, does withdrawal method cause pregnancies even if the male did not ejaculate in the female?
I love that question, because that's what a lot of persons rely on nowadays, withdrawal. Because we believe that from the person withdraw, and this is another misconception, is that from the person withdraw that we're not going to get pregnant or not get a STI, but that's actually false, because men produce what is called precum, and not even the men themselves that produce this sweet water knows when it's gonna come. So there's really no way to escape that. So yes, persons who actually practice withdrawal can get pregnant within a year. So it's not as effective as you might think, especially with the fact that precum is there. And then a lot of us are not really in tune with our bodies, like know the length of our cycles, know when to ovulate, and all of these things. So if you're using the withdrawal method, you're not in tune with your body, don't know how long your cycle be, it will fail you. The thing about natural techniques, in order for them to be effective, you very much have to be in tune with your body. And then if you're gonna do the withdrawal, you have to know again when you're ovulating, because if you're gonna have unprotected sex while you're ovulating, and then thinking that using a morning after emergency contraceptive going to help, it might very well fail you. All right, so withdrawal is not a best option. You'd have to be very, very, very in tune with your body, know the different changes and all of that.
Thank you, Miss Watson. Mr. Tomlinson wants to add something.
Yeah, I know that we're talking a lot about the different contraceptives related to, how women can prevent pregnancy. But just a reminder that you also have to take into consideration the different STI that are out there. Because I was looking in the chat also, and I see, persons talking about pull-out game and stuff like that. And I know we're going back into school right now, on campus. That's the talk, that's a conversation. And I know sometimes, on campus, various activity can take place. And I just want to ensure and encourage persons just to be safe as it relates to sex, right? Protect yourself, use a condom, yeah? And there are different outlets that are available for you to get your condom free, as I put in the chat. Just a reminder, right?
Thank you, Mr. Tomlinson. And that's very important, because we've often said in the office that a lot of times when persons use contraceptives, it's not necessarily to protect themselves from sexually transmitted infections or diseases. It's because they're thinking about pregnancy. And I think that is something that we often forget when persons are having sexual interactions, is that it's two sides to the coin. You're trying to, if you're not interested in having a kid as yet, you're trying to prevent pregnancy, but you're also trying to protect yourself. Laura, I don't know if you want to continue taking some of the questions in the chat.
I would love to actually. I'd like to facilitate if there are any other questions, because I want us all to be having the conversation and understanding the importance of our sexual health and asking the difficult questions. So this is your opportunity for the next, I want to say 2 minutes, 5 minutes. What do you think about that? Just to facilitate any other questions. And of course, in this moment, ask the panelists to really give us any sort of last remarks that you'd like to say to the students of the University of West Indies, especially those at the community student body. Oh, wait, we have a question before you guys go. And this is from Rajay, and he says he's been seeing research on male hormonal contraceptives, if we have anything on that.
Not currently. Not currently here. Mm-mm. So probably in the next coming years or so, let's see, but not currently.
Yeah, and if I may add, I just want to encourage persons to visit T.A.B.S at 8 Cargill Avenue. You can visit us at the Western office that we have in Trinity Mall, 3A Barnett Street. You can also, we're partnership with JASA, Jamaica Aid Support for Life, Children First, and AHF, JN Plus, National Family Planning Board, and Chairs on UWIC campus. You can go to these places to do your checkup. STI, HIV, and syphilis testing. Check them out, have these conversations, ask the question that you want to ask, and also just get tested. Yeah, we're giving away free condoms as well, right?
Love that, love that. And also, let me see. Right, so the information was placed in the chat, and so that's what we're working with. But like I said, everyone, I do want to facilitate one more question before we close up. I think that's suitable, right?
Yes, Amalora, any questions we want to ask, you guys can place it in the chat. Every year, the office has this session around safe sex and sexual health because some students feel like they know everything, but when they come, they realize there's so much more to learn.
Agreed wholeheartedly. And here's a question, and this is the last question for our session. How is a condom ideally supposed to feel when one is wearing it? That is.
I mean, I can never ever speak for anybody else, but there are varying condoms out there for persons' comfort in their sexual act. I mean, there are condoms that are thick and there are condoms that are thin. I mean, there are also condoms out there that it feels like the skin. I think there's a condom out there called Skin Now. So persons may be they may have some sort of discomfort using condoms, but I mean, if you really check these different outlets and even go to these organizations and speak to your healthcare provider, they will have some recommendations for you. So in terms of your question, in terms of how is a condom ideally supposed to feel, I mean, I can understand that. I can't answer that for you because really and truly persons have different feeling relating to the different condoms they use. So
Before Mr. Tomlinson, sorry, goes, I want to ask a question because a lot of the conversation has been centered around heteronormative relationships. And a lot of times, not only Mr. Tomlinson, but Miss Watson, persons feel like because they're in heterosexual relationships, homosexual relationships, sorry, they cannot get pregnant, they don't use contraceptives. What advice would you give to them re-getting tested and using contraceptives?
use a condom, use a condom, use a condom, use a condom. That's the best advice I can give. Use a condom all the time. All the time. One of the disadvantage of having these conversations, I mean, we can't have them in high schools like that. I mean, it's almost like, you have to water down the information. I think it needs to start, in those places, those avenues come right up because people are exploring these days. People are exploring, people are doing their threesome, orgies, all of these things all over the place. And, you have to know how to use the condom correctly. For example, I've been having conversations with young people who are engaged in threesomes. I always ask, okay, so if the dominant person is using one condom and they just use it on one person in the act, what do you think they should do after using it on one of the persons in the sex act? Persons can relate. Of course, that condom needs to be changed. So the education, the information component as it relates to these kind of sexual activities need to be had. So, yeah.
And Miss Watson, what would you like to add? If you would like to add anything, that is.
All right, so I believe that whether heterosexual or from the LGBT community, I think it should it doesn't matter your sexuality at all in my school. Sexual health is everyone's responsibility. You can't leave it on anybody else's. You can't expect that somebody should be responsible for what happens to your body. So no matter your sexuality, your health is your responsibility. And if you don't want anything to go wrong in your body, whether an STI or to get pregnant at a time that you weren't expecting or wanting to, the onus is on you to prevent it. So knowing where to get services, access services, is very important. And these are things that you check up on a regular time, especially if you're putting yourself at risk. If you're having unprotected sex, go and get tested. When you know your status, you make informed decisions to your health. You find out that you're positive. Best and safest route is to get treatment and to use a condom if you're going to continue having sex to prevent the spread of it. And if you're negative, doing what is best in your interest to prevent yourself from becoming positive. You're not planning to get pregnant, but spur of the moment, young, wild, and free, and things happen, you go unprotected. You know that the likelihood that you can become pregnant once you're going unprotected, it is important that you need to be on a method to avoid getting pregnant in those situations. So again, sexual health is your responsibility no matter your sexuality. And if you're not looking to get an STI or to become pregnant, it is on you to prevent it. All right.
Thank you, Ms. Watson. Laura, you can close off the session now.
All right, I love this. I love that we had this conversation, everyone. Unfortunately, all good things must come to an end. And that is the same with this session. We want to say thank you, a big thank you to the panelists who joined us this evening. Thank you so much, Mr. Rudy Tomlinson. Thank you so much, Dr. Samantha Johnson. And thank you so much, Ms. Samantha Watson. And of course, we want to say a big thank you to you, Imona Community student to practice good and safe health. And that is so we're ending it this evening. Thank you guys so much for coming out and have yourself a good evening.
Thank you. I'd also like to thank Dr. Tina Hilton Kong, who is a member of the UWI Health Clinic, UWI Health Center, who has been providing some useful information over in the YouTube chat. Have a good evening, everybody.
Baby, everybody get cool, oh. Nah, nah. If I give you all my love, would you treasure? Would you cherish it and never let me go? Cause you're not gonna find someone to love you better. Oh. If I want him there for certain, I want you. Make I go love you, make I go love you. Make I go love you, make I go love you, tender, oh, tender, oh. My love, they eternally. I love you for eternity. Oh, my love, they eternally. I love you for eternity. Baby, me ready. Been too long, I'm ready to